Hey everyone, thank you for watching this video. This is the first in the series of 5-minute or less videos that I'm posting in Blackboard. And the intent of these videos is to take a concept in the course that's maybe a little bit more difficult to understand and to break them down into component parts. So by the end of the video, you should have a better understanding of the concept. As a challenge for me, I'm going to try to do that in 5 minutes or less. When we look at all these terms, it's probably logical to ask the question, why are there so many terms to describe the integration of evidence into practice? The short answer is, as time has gone on, our thinking about this has changed and we've progressed from focusing maybe on using evidence in one particular discipline, such as medicine, and then broadening out. And then also we've sort of changed our perspectives. But as things are, some terms go out of fashion, other people hold on to these terms but maybe change the definition. The result is we have lots of different terms floating around. Sometimes some of them are used interchangeably, rightfully so, and other times they're not. As far as what's important to the context of nursing, we'll talk about that at the end of the video. Evidence is at the heart of an evidence integration process, but the term evidence is differently defined depending on where you're at. In this course, we're going to try to keep it simple. The term evidence will be used to reflect a broad body of knowledge from various different sources, including empirical evidence. And we defined empirical evidence at the beginning of this course as knowledge that is based on research findings. So while they can be used interchangeably, we're going to keep to that. So evidence as a term is going to be broad. Empirical evidence is focusing on research. Now, it doesn't matter what kind of evidence you're looking at. A user or consumer of evidence must appraise it first before it can be integrated into practice. And the sources of evidence or empirical evidence that we're going to be looking at in this course include systematic reviews, research studies, and then summaries in peer-reviewed journals. Probably the least common of the terms that you'll see is evidence-based medicine. And evidence-based medicine was the beginning really of this modern application of evidence into practice. And so it's defined as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of patients. Simple enough. And it also talks about integrating in clinical expertise. Now, as other professions got wind of this and started to consider it, they began to adopt these tenets, and emerging from that is the term evidence-based practice. So evidence-based practice is really reflecting the use of evidence in the way that it was first articulated by medicine into other professions. Now, the reason why evidence-based practice is sort of a bit of a thorny term is that many have argued that it overemphasizes empirical evidence of a quantitative nature, and particularly on a hierarchical structure, and less on other ways of knowing. And while others have argued, no, that's just an interpretation, there has been an acknowledgement that perhaps maybe using a different term, such as evidence-informed practice, will help to shift people's perspectives. So evidence-informed practice has emerged as a concept that really builds on evidence-based practice, but strongly emphasizes that it is more than just using empirical evidence in practice, and not just quantitative empirical evidence, but qualitative and mixed methods, as well as looking at other ways of knowing and other forms of evidence, such as the patient's preference, intuition, ways of knowing from an indigenous perspective. And so evidence-informed practice becomes a much more complex endeavor, and I think it perhaps reflects more of what happens in reality. So where does that leave us in terms of some of the other terms out there? Evidence-based nursing practice, evidence-informed nursing practice, evidence-informed decision-making. These terms are derivatives of the other ones we reviewed. And in essence, they're really used to reflect the disciplinary focus or the emphasis on something like decision making. All right. So what do we take away from all of this? Well, for the purposes of this course, one of the key things you want to make a distinction about is that evidence-based practice and evidence-informed practice, while they are overlapping, are not exactly the same thing. Evidence-informed practice builds on evidence-based practice by acknowledging and ensuring consideration of other factors other than empirical evidence to influence decision-making and actions. And in fact, if we're looking at it from an even broader perspective, it acknowledges that evidence might take a backseat. Now, when I say evidence, I mean empirical evidence in particular, might take a backseat to other ways of knowing and, in general, to patient-centered care. All right, that's it for this video. Check out the other videos in the series, and if you would like to talk more about this topic or any other ones, join me for the weekly office hours in Collaborate.